Hello, welcome
Mhm.
to the Let's Talk Kids Health Facebook Live Show, episode 28. I'm Dr. Narissa Bauer, your host. I'm a behavioral pediatrician and blogger of Let's Talk Kids Health. As you know, the concept of this show is to share information about behavioral health, parenting, and family wellness. Each week, I bring you topics and guests to help me advance this mission so that we can all talk together. Now, remember, if you're watching this live, you'll have the opportunity to post comments and ask questions of my guest. Let us know that you're here by dropping a comment, giving us a like, and using hashtag live. This replay will be immediately available after the broadcast, so please share this episode with anyone you think who would benefit because sharing is caring. Now, and if you don't want to miss future episodes or maybe check out some of my past ones, please subscribe to my YouTube channel, Narissa Bauer MD, and follow my blog Facebook page, Let's Talk Kids Health. All right, so now on to this week's guest. Let's welcome Dr. Nicole Steber. Dr. Steber is a
Hi.
pediatric hospitalist with Riley Hospital for Children and an assistant professor of clinical pediatrics with Indiana University School of Medicine. She works mostly with newborns and enjoys helping children and their families. As a mom and pediatrician, her goal is to improve the world for the next generation. She has personally experienced postpartum anxiety and depression, and she's passionate about promoting recognition and treatment for others. Thank you, Dr. Steber, for coming on the show.
Mhm.
It's so nice to reconnect with you.
Yes, thanks for having me.
Yeah, it's always a joy. One of the things that I love about doing this with this show is just being able to reconnect with my guests. And as you know, we used to work together, so it's been wonderful to have this opportunity to have you here. So thank you so much for sharing your story and sharing your wisdom about this important
Mhm.
topic.
Yes.
Uh, so I thought I'd start, just by asking a question, and I'm going to read it here. What exactly is postpartum anxiety or depression, and who does it affect?
Yeah, so most people have probably heard about baby blues or seen, especially like a new mom in the first few days or up to 2 weeks, kind of crying for no real reason or being really emotional or feeling a little different. And postpartum depression is if that lasts longer than 2 weeks, anytime in the first year after birth. Or if it is severe enough at any time to really affect functioning. So it can present after birth and can present anytime in the first year, and in some studies, even up to the first 3 years. Uh, yeah. And then
Yeah.
I guess who does it affect?
Hmm.
Yeah, so it affected me, and I thought I was very prepared being a pediatrician and trying to have kids for years. But yeah, it affects up to 20% of moms and up to 10% of dads. So 1 in 5 moms or 1 in 10 dads. And it could be more than that because I know a lot of people, when I talk about it, say, like, oh, I had similar symptoms, but I didn't reach out or kind of know what to do. Um, and so it's very common and something we don't want people to feel like they're alone
Yeah.
with.
Right. And I before I left academia, I actually did some research on this too. And as you said, it's quite common, and it can actually be up to 50 or 60%, especially in the lower
Okay.
income, uh, f-
Mm,
families too. So it definitely is there. And I'm just curious, being a pediatrician, and obviously you know about
mhm,
this. We know that we are supposed to screen for this at certain well child visits.
mhm,
Like, if you don't mind, could you share a little bit about your experience? I mean, how did you
mhm.
know that this was indeed what it was?
Yeah, of course. I mean, of course, I'm happy to share. Not of course, actually, I wasn't sure. So really, I was just kind of over the moon excited after we had our first miracle baby, and got myself really sleep deprived, with which can happen with newborns. And the more sleep deprived I got, the more really scared I was that I would fall asleep and something bad would happen to him. And um, So I was kind of actually having, like, when I started to go to sleep or wake up, sometimes like a hallucination in that phase where I thought he couldn't breathe or something, even though he was safe in his crib. So I did reach out to help because I called my OB and I said, I'm not depressed. I'm super happy and glad. And I didn't even realize I was anxious.
Mhm.
And one thing that I look back on is, and I ask other people, like, are you able to sleep? Are you able to eat? Because I didn't call anyone and said I had anxiety. I just was kind of overly concerned. And then definitely when going back to work with both of my kids was a hard transition. I wanted to be with them, and it was hard for me to let go of, well, yeah, let go of control a little bit. Um, that was hard, and I would have anxiety with my daughter. I actually had a panic attack for a week, and kind of breast milk dried up and couldn't eat or sleep. And then I had to ask for time off from work, and I've never missed a day of work before then.
Mhm.
So the idea of just, hey, saying, oh, I'm not ready, I need some more time, that didn't even occur to me. So I just kind of pushed until kind of broke, and then kind of had to get help and kind of work my way back.
Yeah. Um, I thank you for being brave to share your story. I mean, I think it's really a difficult thing to feel like, you know, that you're looking forward to this pregnancy, and then all of a sudden these different feelings come about, right? And you said that you
Mhm.
weren't feeling depressed. It was more the anxiety that really reared its head, right?
Mhm.
Yeah. Well, I'm glad you got some help. I'm
Mhm.
glad you got some help. So,
Yeah, very thankful. And
yeah.
after the anxiety was bad enough, I did feel depression,
Mhm.
kind of anxiety first and then um, depression. Just wanted to sleep all the time after I hadn't gotten enough sleep and decreased energy and things.
Mhm.
So I realized that some people may have one or the other, and you can also have both.
Mhm. I think if there's anything that, one of the things that as pediatricians we want to always make sure that we catch these symptoms as early as possible so that we can get
Mhm.
help for moms and their babies. But as far as what you're aware, if you can share with the people who are watching or listening, how can untreated postpartum depression affect our babies?
Yeah, so we know the maternal infant bond, caregiver infant bond in general, but especially the maternal infant bond is very important. And if you're consumed with anxiety and or depression, it can kind of affect the ability or the type of attachment that you can form with the baby, and that can kind of affect kind of their development also. So we know that kind of seeking treatment early and that treatment can help is really important. I try to tell parents, some people will be like, oh, I just, push through. It's not a big deal. And that, taking care of yourself is the best thing you can do for your baby. A healthy parent is the best thing
Hmm.
for the baby.
Yeah, that's so true. And I guess, you know, is there anything like in hindsight that I guess I'm going to lead into this one, like what can we
Sure.
do to help ourselves and others, but is there anything that anybody could have said to you that could have helped, or and what should we avoid saying, right? In that?
Yeah, no, unfortunately, like if you have perinatal mood disorders, there's nothing you do or someone could do to really, it's not your fault or anything you could do differently. Um, after having postpartum with my first, I thought, okay, I'm super prepared for my second. I was a psychiatrist and a therapist, and we made plans to where I wouldn't get sleep deprived. And so I didn't have that initial sleep deprivation, and the first 3 months was easier.
Hmm.
But then going back to work with a baby and toddler at home just felt like too much. And what I really appreciated was friends and family just reached out just to let me know they were here. I often may not have even replied because I felt so overwhelmed, but if I got a text or a voicemail, or especially like if I just got a little letter with them saying, they were thinking of me or praying for me, that was really helpful. In addition to, helping to get that sleep was nice too.
Hmm.
Helping to help with the toddler and help me sleep and things like that.
Yeah. So self-care is really important.
Mhm.
But
Yes, for
even
sure.
though you weren't necessarily going to or able to respond to every single text message or whatever,
Mhm.
you still appreciated hearing from folks, knowing that they're there.
Yes.
Yeah.
Yeah, definitely. It was I probably haven't told everyone how helpful that was, even though most of the time I probably didn't respond in definitely the most severe week or two of kind of the panic attack. But it was very much appreciated.
Hmm. I mean, it sounds like because you had postpartum with your first, and then you were preparing for the second, but yet there were still other issues around the second after the second pregnancy that you said
Mhm.
was still challenging. Is there anything else that you would say now in hindsight to somebody who is like worried about the possibility, or maybe is pregnant again and has also suffered from postpartum that they could potentially do?
Yeah, I mean, thinking of how much worse it could have been had I not had help from friends and family and a therapist and psychiatrist. I think it's, really important to consider having someone to talk to, or, people to support. Um, and in addition, I wish I could have told myself that if you don't feel ready to go back to work, you can actually just say that. Say, I just don't feel ready right now. I feel like I need a little more time off, or maybe even, is there a way I can help with things but not work the 12-hour shifts or something like that? We were talking a little bit beforehand. I had told my therapist I wish 10 or 20 years ago I would have done more mindfulness and meditation and things like that that I've just recently gotten into. And she asked if I would have done it then if someone offered or suggested. And I said no, I was too busy, trying to um, get 100% on the test and all of those type of things in life.
Yeah,
That I would tell myself that, but it's all kind of about where you're at, I guess, in your phase of life.
that's right. That's right. So, I mean, could you say a little bit more about that with meditation and mindfulness? Like, how are you using that?
Sure, yeah. So with kind of the postpartum, I actually, around like the 3 to 4 months when babies kind of wake up and they're more interactive, I sort of felt like I always had to be interacting with them. Basically, if they were awake, I sort of felt like I needed to be smiling at them and interacting with them. And that actually gets really overwhelming. And it could sound like a scary movie for a baby too. They probably don't want the mom in their face all the time. Um, I think the mindfulness and meditation um, kind of helps me to be kind of more relaxed and kind of present and aware of my own kind of feelings and emotions. And I had tried kind of different kind of apps and things like that. Sometimes, there's the Calm app that different things had seemed helpful. Really a life changer for me, and not to promote a specific thing, but the 10% Happier kind of mindfulness meditation app has just been a life changer. Even I'll just listen to it in the car all the time. Of course, I don't close my eyes, but just like listening to the way they talk, and um, I just basically learned to be kind to myself,
Mm.
and that's been the big change.
Yeah, so it's interesting. I actually did a show earlier with Dr. Catrice Brooks in my parenting discussion group about self-compassion and parenting. It's interesting that you say you learned how to be kinder to yourself.
Mhm.
Is that, can you go a little bit, can you explain a little bit more about that?
Sure. Actually, I mean, I vividly remember it. We were at a lake house, and I was sitting on this frozen lake, not on the lake, but on a dock, and listening to one of the 10% Happier. It was a New Year's Eve meditation, and um, the the teacher or whatever said, "Would you treat your friends like you treat yourself?"
Mm.
And I just had this moment like, "Oh my gosh, no! Like I am so mean to myself, just always pushing myself harder." And thought that was just a big breakthrough. Like, I should be nice to myself and kind and forgiving. And it's still a process, but
Hmm.
it's very helpful.
Yeah. May I ask, I mean, in terms of, you know, were you hearing a lot of those just negative thoughts about like your ability to be a mom, or was it more just the other themes?
It's always kind of been the perfectionism,
Hmm.
kind of the it's never good enough. I always have to try harder or push harder. And the more important something was to me, or the more stressed I was about something, the harder I pushed. And that kind
Yeah.
of always worked in the past. But it doesn't work for parenting. So, just like pushing harder and working harder didn't work, at least for me, for parenting. And I think the kids just needed me to be present with myself and them and be kind to myself and that kind of thing. I think Brene Brown said, you can't teach your kids not to be a perfectionist if they're seeing you be a perfectionist.
Yeah.
And I thought, "Oh, no, like, this is awful. How am I ever gonna work on this?" But, slow but sure, I'm a 5-year-old mom, and I'm growing and learning, every day just like my kids are, so.
Yeah, yeah, and that's the beauty of it. I mean, there is no instruction manual for parenting that's a one size fits all. And I think you said that perfectly. I mean,
Mhm,
life where the best that we can do is to just keep ourselves open and be learning alongside our kids, right? I mean, they
mhm.
teach us so much about ourselves and
They do,
and
yeah.
and that we need to take care of ourselves, right? So, because
Mhm.
you're modeling so much for them, everything, the good, the not so good, and everything in between, they're picking up on all of that. So,
Yeah, I see a lot of parents of newborns,
yeah,
and not infrequently, I see parents that are fairly stressed about trying to be perfect, and
yeah,
they want to do everything perfect, and they don't want to mess up. And I had this realization at one point in time that even if you could be perfect, that would not be perfect because your kids need to learn how to deal with adversity and how to say, like, "Oh, I'm sorry, I messed up, and this is how we work through things." And that seems to have actually gotten through, well, to me and to other people. They're kind of like, "Oh, wow."
yeah. Well, I guess, if I could ask you, I mean, so through your own experience, you've sought out and found some resources. But, are there what are those resources for parents, or your go-to that you recommend when you're talking to families in the newborn nursery?
Yeah, so I wish I had more, and I know it can get overwhelming, but there is always the Postpartum Support International,
Hmm.
and it's not an emergency crisis line. So if you feel like you're having thoughts of harming yourself or others or your baby, definitely call, the emergency 911 number or the suicide prevention hotline. But Postpartum Support International you can always call and someone will get back to you. They have free support groups, and I was actually on their website today, and there were over 14 specific support groups, and one was for dads, and one was for NICU parents of premature babies, and kind of all these different things. That it's nice to just hear that you're not the only one going through this.
Yeah, I mean that's huge, right? I mean, because in the moment it can feel very isolating and you're all alone, but those
Mhm.
support groups are huge. I actually the ex-president of Postpartum Support International locally, he will be on the show, and she just
Oh,
scheduled an episode. So,
great.
yeah, and those groups are so important. And the nice thing for pediatric providers, family physicians watching, and if you're not sure about resources, Postpartum Support International has a chapter in every state and the U.S. territories. So all you need to do is go to that website, and you'll be able to
Mhm,
find local support groups there. And they do have support for dads,
mhm.
which is great, which is
Yeah,
great.
yeah,
Yeah.
really important. My husband wants to, talk to dads also because he had anxiety about being a new dad and, how is he supposed to be a good dad and things like that. And it sounds like for men, at least from his perspective, it's talked about even less. It's
Hmm.
even less acceptable for possibly for a man than a woman to say how they're feeling or, that they're having anxious feelings or something like that. So to know they're not alone, I think would be really helpful.
Yeah. And again, I think just being being first unafraid to sort of talk about it with your provider, your OB, reaching
Hmm.
out for help when you can, because that's the first step too. So.
Hmm. Yes, definitely.
Yeah. So, is there anything else that you'd like to share about your experience or just in general, like being a pediatrician, do you feel like it's changed the way that you practice medicine and how you approach your families in the nursery?
Yeah, a lot because I am more aware of things and recognize more things that go been through it myself. When I walk into a room, the typical, like, oh, hi, how are you? The typical response is good, or, one of those words. But if I kind of sense that there may be some other worry or anxiety or depression, I kind of, sit down and say like, how are you? How are you feeling? And just kind of sit and wait and kind of give them a little bit more time and space. And that's helped in some cases and sharing, that they're not alone. A lot of people go through this. It may be similar to I'm not sure if it's similar, but maybe you could correlate it to, 1 in 4 women have had a loss or miscarriage, and a lot of people feel really alone. And when kind of other people stand up and say, they've been through that also, it might help.
Hmm. Yeah. I mean, I'm sure that the families really just love the fact that you're taking that extra time just to check in with them. And even though they may or may not at that time feel,
Hmm.
the symptoms, just being able to know about it because that's why we screen for postpartum depression and anxiety at
Hmm.
multiple time points through the first year of the baby's life, which is really
Yeah.
important.
It is because like my symptoms didn't get bad until 12 weeks when I went back to work, kind of between that 3 and 4 month time period. And you are seeing your pediatrician more often, and my pediatricians were great at kind of asking me how I was doing, and I had already reached out because I knew I knew like I needed help. But I thought that was really good that that as pediatricians we're trying to you know, really check in on the parents too at the visits and see how they're doing. I always tell parents of newborns if they find themselves feeling really stressed or really down, can't eat, can't sleep, or any scary thoughts, because people can sometimes have kind of intrusive thoughts that maybe you may be scared to tell anyone. Definitely reach out right away to your physician and your support network.
Right. I think, as I mentioned, I had done a little bit of research in this area too, and I had done actually some interviews with those moms at some of those support groups, and I think a lot of women there's that fear of saying I have these thoughts, and the
Hmm.
fear of, Child Protective Services being involved. There's
Hmm.
just that stigma of, I need to be happy.
Hmm.
Motherhood is like this thing that we're supposed to be happy. And that's
Mhm.
why stories like yours, I think, is so important to share because there is help out there,
Mhm.
right? And hope.
Yes. Mhm.
Yeah.
Yes.
Um, so, thank you so much for again sharing your story, for being brave and coming on and sharing that. I'm so glad to hear that you're doing well. You have two
I
healthy
am.
children. Yeah.
I do. Yeah.
Yeah.
They seem like they're doing fine so
Yeah.
far.
Yes, they are. They are. They are. And I just, thank you so much for being so willing to be an advocate for other women who may be
Mhm.
feeling the way that you did and helping shed light on it. It's so important. So thank you.
Mhm. Yes, thank you.
And so, just to wrap this up, I'm going, as you know, I always have a guest every week. So, next week's guest is Dr. Michelle Quirk, who will be talking to us about making family fitness fun. She's a running coach and a fellow entrepreneur who I've met, and I cannot wait to have her on the show. And just a call for everybody watching. Now, if you have any suggestions for future topics or guests, please feel free to reach out to me at Dr. Narissa at letstalkkidshealth.org. And again, if you are watching and you're like, hey, I could talk about this, right? Please just don't hesitate to reach out, message me, comment, send me anything. I'm on Instagram, Facebook, LinkedIn, you name it. So I'm everywhere. So, and remember, consider subscribing to my YouTube channel, Narissa Bauer MD, to be alerted each week or follow my blog Facebook page. It looks like, hold on, we have one. Oh, we do have one comment. Thank you, Brittany. She says, thank you for your story. Thank you so much. Thanks for commenting. And again, I just want to thank you so much for being on the show.
Okay, thank you.
Uh-huh.